Lyme disease is an infection by the bacterium Borrelia burgdorferi, and it is transmitted to humans through the bite of an infected tick. Complications if not treated promptly can include problems with the heart. Also, neurological symptoms can arise, and it can also lead to post-treatment Lyme disease syndrome. It's really in that early phase of infection where we see that there's a gap in being able to accurately diagnose patients.
So one of the key problems with Lyme disease diagnostics is the sensitivity of the existing test for early stages of disease.
We use serology-based diagnostics, and this requires an immune response to mount prior to being able to detect the infection. And so that takes some time. So the innovation in our test is really to try to use a novel method, something completely different that does not rely on an antibody response.
The research is looking at metabolic profiles in clinical samples to develop a diagnostic for Lyme disease. We look for a pattern of small molecules that are representative of an individual that has Lyme disease.
It's really been a fusion of several institutions and different expertise to be able to do such a challenging project. We have partnered with Colorado State University with investigators who are experts in metabolomics and are applying this method to various infectious diseases, as well as with physicians at New York Medical College who have expertise in working with patients directly that have Lyme disease.
We realized we had something when we could actually detect a number of Lyme disease patients that could not be diagnosed with the currently utilized test.
In our first study, we were able to identify 77 to 95% of cases that were otherwise negative by two-tiered serology methods.
So the next stages in terms of development of the test is to move this to a platform that can be applied in clinical laboratories. So this really is changing the paradigm by which folks are looking at the diagnosis of infectious diseases.
The most fulfilling part has really been to try to come up with a novel method that may have some hope for patients and also to help clinicians diagnose this infection. I do believe that we are onto something here.